Good morning. Good morning, everybody, and thank you for joining the webinar this morning on advanced care planning for people living with dementia. We're very grateful to be able to have partnered with Dementia Australia on this work and to have such a great array of speakers and panelists for today. Before we begin, I would like to pay my respects, acknowledge the traditional owners of country throughout Australia and recognise the continuing connections to land, waters and communities, and to pay our respect to Aboriginal and Torres Strait Islander cultures and to elders past and present. We have had an overwhelming response to this webinar, including a range of questions, some of which we will be able to address at the end, but some we will not. We've had an extensive range of questionings around voluntary assisted dying and dementia, and that is a webinar in its own right, which requires a whole different set of panelists. So that is something that we will not be addressing in our response to our survey, the questions today. We will be sending out a frequently asked questions list based on the questions that we have received that are relevant to advanced care planning in dementia. And at the end of this presentation, you will receive a survey and we would appreciate you responding to that survey in order to give us some feedback about how we can improve our webinars. So on our panel today, we have an extensive range of people and we are so grateful to have them. We have Heather, who is a dementia advocate and has cared for many family members, including family members living with dementia, and is currently caring for someone with a cognitive impairment. We have Anne, who is also a dementia advocate and is living with dementia. We have Professor Dimiti Pond, who is a GP and honorary professor from the University of Newcastle, and Dr Craig Sinclair, a senior research fellow from the School of Psychology from the University of New South Wales. Before we introduce you to those panelists, I thought it was important that we discuss what is ACP, what is advanced care planning? And largely it is the reverse of what it says, planning for care in advance. And it involves discussing, talking about, thinking about what it is that's important to you, what care and medical treatments you would want and would not want, who it is you would want speaking for you, and what it is that you would want them to say. And then after that, to write those things down so that they're available to health professionals, family members, and others providing care so that they are able to provide the care that you want in the environment that you would choose, in the manner and way that you would want, and that you would have the people making decisions for you and speaking for you just as you would want them to do. We know that the prevalence of advanced care planning documents is quite low across Australia, with only 14% of Australians over 65 years having an advanced care planning document in their medical record. Based on research that Craig Sinclair has been involved in, that also showed that over 39% of people living with dementia had no advanced care planning document, and over 29% had a document that was completed by somebody else, by a health professional. So this is an opportunity for people attending this webinar to understand advanced care planning, to understand advanced care planning in the context of dementia, and to know where to go for more help and support to improve, not that statistic from the point of view of a statistic, but so that each individual has had the opportunity to participate in advanced care planning and make their wishes known. Some stats on the prevalence of dementia in Australia. It is estimated that there are more than 400,000 people living with all forms of dementia in Australia right now in 2023, and that figure is projected to double, to more than double by 2058. And that every 3 seconds, someone in the world develops dementia. that there are more than 28,000 people with younger onset dementia in Australia. And those other two stats we have mentioned already. So it is my great privilege now to introduce to you Heather, a dementia advocate and somebody who has been a carer of many family members, including people with dementia, and is currently caring for somebody with a cognitive impairment. Thank you, Heather.
Thanks, Anthony. Hello, I've been a dementia advocate for a few years, and I have a lived experience of caring for people with dementia and cognitive loss. I've cared for 4 people who have ended up in aged care, which included my grandparents in their late 80s and both my parents. 3 of them, though, have now passed away. I was the only carer, being the only daughter and the granddaughter. It was all left up to me, which is the case in a lot of families. I have one brother, but let's face it, it probably wasn't his thing anyway. When my grandparents died, I was an executive in the public service and was also having a baby. I was in my early 30s and ended up leaving my job. It was all just too stressful balancing my caring and work demands. So bringing it back to today, I guess what's most relevant to this webinar is my mum got diagnosed with dementia, or a frontal temporal lobe dementia, at 54, and she had it for 17 years. She really deteriorated when I had a young child. So carrying all of this as a carer has led me to needing trauma counselling and a PTSD diagnosis. So today I'm motivated here because none of my family had their affairs in order, or had even considered advanced care planning. I'm motivated to encourage you to make it easier for your carers, family and friends, especially when you need them. So as a person living with dementia who's considering the advanced care planning, you're releasing me as a carer from the decision-making complexities and the burden as your dementia progresses. You need to consider the consequences of your planning and the decisions that you are making. And, things like, what do I need to research to understand more? And, things like, what does life prolonging actually mean? So now is the time to know your rights, which empowers you to make good decisions that I will stand by as a carer. You're empowering me as your carer with the confidence I'm doing the right thing for you, and I'm not left guessing or even hoping I'm doing the right thing by you, or with regrets or doubts if I wasn't sure. You are showing respect for me as your carer, who is helping you along the journey, so I can along the journey. It gives you control over your life when you may feel like you've got none. This means we can enjoy our time together, which might be short or long. We don't ever know. But what we've prepared, and you've taken some of the pressure off of us or me. And we'll talk more about that in a moment. But as a carer, by doing your plan, you're releasing me of a burden of decision making in a time that's probably already incredibly stressful for me as a carer, and at a time when you're possibly unwell, needing my attention, or needing other practical things like a nightie for hospital, or your bills paid, or having the family updated, as well as keeping my own life going because I've got my own kids' job and my own health issues. It means I'm not dealing with legal worries like what's the meaning of capacity and I'm trying to get people to sign a document. I'm empowered by this document, dealing with all these things at a time that I want to focus on you. We just don't know how things are going to progress as the dementia progresses, as it's all so individual and not even the doctors know how it's going to affect you. With my mum, we found ourselves in a crisis, and that's why I'm here today. As a carer, I was under great pressure to make a decision immediately about starting or ceasing a treatment. Sometimes we're making complex medical decisions and there's so many options thrown at us. Some decisions are life or death, and I might not have all the information I want. There's not a lot of evidence-based research on some of these things and how they affect people with dementia, and often there's just no clear pathway. As a carer, I've never felt so alone as when I've had to make some of these decisions. Often these decisions are in highly stressful and time-critical situations when our normal support, such as social workers, dementia consultants, and family, might not be available right at that moment, because that's exactly what's happened to me. Some medical decisions have some really big consequences, and no one knows how they're going to affect you. The doctors don't know, and often the medical staff who are telling us don't know you or your history or how you might react to those sorts of interventions or medications. But it's hard to find your way through when things are all just going so wrong. But I will have your plan, and that will be my roadmap. So I might be pressured to make fast decisions on whether to medicate for things. You might be faced with decisions about whether to tube feed you or CPR, or whether to have palliative care at home, hospital, aged care, or when just to stop it at all. And they are all the decisions that I've had to make. So it's about knowing those decisions and when that are going to have to be made and when you want me to stop. It also helps me not to get caught up in all the medical focus on extending life and the over-medicalisation of things, including death. It also helps me to know my position when I advocate for you and have the confidence in my decision-making, especially when I'm caring for you as I love you, but also I find it rewarding, I'm motivated and I'm committed. So I may not be there for you for whatever reason at that time, because sometimes these crises happen and I might not be available, but we'll have this document to protect and preserve your values at that time. So with grief, having a plan enables me, well, with grief, we know that carers grieve harder than others in the family because they've had that relationship with you. Having a plan enables me to deal with my grief in the best way possible with confidence and my family intact, and we're all on the same page about what was decided for you. It helps me know I've done the right thing when I'm already coping with loss and reflecting on the decisions that we've made for you. It's about my memory of you in the stillness and the quietness when you're gone, and knowing that I've done the right thing and I can live with no regrets, and it helps me in my stages of grief. With our families, we often hear it's about what mum or dad would have wanted. Do they really know? Do they really know what's best for you? What happens with the family are arguing what they think that was? I'm sure they've never considered some of the situations that I've faced. If you've got a dementia diagnosis, do they know what you actually value now? Are they sure about what your religious and cultural beliefs are? Have they changed? I'm sure you might find that there are some differences, because I have heard that there is sometimes when you do the plan together that you might find that what you would have wanted and what they think that you would have wanted are two different things. So at least now everyone's on the same page through your journey. You don't want your family to break down on a disagreement about how it should have gone. I was in a unique situation as I was the only one. However, this is often not the case, and we all know families that have broken down over these sorts of things. So to me, it's about leading a quality of life that you want to leave, however, being realistic about knowing your diagnosis and what decisions you could face and what the outcome of those decisions are. It's about being empowered, knowing your rights and values are carrying on even when you've got no control over other things. It doesn't have to be another dementia thing. It's a life progression thing, and it's for everyone who's alive. So we all need to die of something. It's about being done your way. So we often need documents for everything, and an advanced care plan is another thing to get your paperwork in order. It enables me to enjoy my time with you as we sail along, knowing I'm doing the right thing. It's also about uncertainty and not knowing what could pop up along the way. And if we're in a crisis, we're as prepared as we can be. I will then hold your values deep to my heart and know the confidence, and know I have great confidence in advocating for you. So this is about you living your best life and having your best death, leaving a great legacy, great memories for those that love you, and leaving your family united and having your carer having the best grief journey they can. We can do it as a gift, because it's a gift to me as your carer. I'll know my responsibility to you, and I'll be advocating hard for you in every discussion and every situation, and we'll often be alone in doing so. So it's a gift to me as your carer and to yourself as well. So thank you.
Thank you, Heather, so much. It's been a real privilege working with you and hearing your story. And it's great that you have been such a great advocate for your family. And I don't know about everyone else, but I would love Heather to be my advocate, I must admit, because she's had to face some very difficult decisions and has done a great job, and is currently also doing that. So thank you, Heather. We didn't mention at the start, but unfortunately dementia is a diagnosis it is a life-limiting illness. And so it is something that all of us have to face, being human. but certainly people living with dementia, it is a life-limiting condition. We often hear about getting our affairs in order, and in every state and territory across Australia, there are different terminologies for advanced care planning documents and legislation about those. We're now going to hear from Anne, who is a dementia advocate and somebody living with dementia. And Anne is coming from South Australia, and so the terminology that Anne will use reflects the South Australian legislation. So please recognise your forms and documents might be called something different in your state. Thank you, Anne.
Thanks very much, Sandy. And it's lovely to hear, Heather, to hear your story and to see how important it is to have an advanced care plan. I just wish that I can get you on. I'll get you to sign mine as well, I think. Anyway, thank you for having me to speak today. And as I'm coming to you from the land of the Kaurna people, and as you know, I have dementia, but I consider I'm living well with dementia. In 2012, I was diagnosed with younger onset dementia, which, however, now seems to be Lewy body dementia. I live at home with my husband, Timothy. He's my carer and is very supportive of me and my advocacy involvement. My mother-in-law had Lewy body dementia, and I also helped to look after her. I have a senior nursing administration background, and in my last paid employment, I was able to be involved in coordinating services and care for older people and for people living with dementia, their families and carers. I also designed and ran specific groups for people with dementia, including a younger onset dementia group. I'm an active Dementia Australia advocate and have been for many years, and I'm involved in a variety of committees and groups nationally and internationally. I consider I'm fortunate to be involved in these different dementia groups and committees where I can advocate for people living with dementia, their families, carers and friends. The word dementia is like an umbrella term, and there are so many different types of dementia, and you can still have the same dementia diagnosis as somebody else, but you can present completely different. So it's important to know that there are no two people the same who have dementia. And as Daphne said, in Australia, each state has its own individual laws in relation to advanced care planning, which is really just basically planning for the future. And the Advanced Care Directive is a formalised version of your Advanced Care Plan. I live in South Australia, as stated, and so I'll give my South Australian perspective, but there are lots of things that are common to all the states and the territories. Soon after my diagnosis, Timothy and I updated our wills, and we completed enduring power of attorneys. This gave Tim and my sister authority to act for me, knowing my wishes in relation to future care and decisions. We are now completing advanced care directives, which weren't available then. When we were faced with completing these documents, Dementia Australia was able to offer some advice and suggestions. However, we didn't have the comfort and guidance and experience of the actual advanced care plan and directives. We had a solicitor who was extremely diligent, and together with my nursing background, we completed individual details, enduring powers of attorneys. And I stipulated my thoughts about my life care wishes, where I wanted to live, for example, live at home, stay at home for as long as possible. My thoughts about my medical care and end-of-life wishes. And my document was then witnessed by my nominated decision makers, should I not be able to make informed decisions. Nowadays, I know that specific information is available from Dementia Australia in making an advanced care plan and end-of-life planning. And we've also got Advanced Care Planning Australia, which has all the information for all the different states. So when it's suggested that you get your affairs in order by a well-meaning person, a doctor, nurse or friend, this is really what they mean. It just means planning for the future. You can plan as little, your plan can be as detailed as you want or as simple as you'd like. In actual fact, Tim already makes decisions on my behalf. With my authority, of course, he always checks with me banking, paying bills, Medicare, NDIS, things that I can't manage anymore. The most important issues, though, in having an advanced care plan for me are that this document is empowering for me. It expresses my values and my perceived thoughts in relation to my life and care, what's important for me to be treated as I want, including my end-of-life care plans. And it's going to assist in ensuring that I'm treated as an individual with my specific preferences for all care now and in the future, including if I can no longer make decisions for myself. I feel safe knowing that Tim or my sister, as my substitute decision makers, I'm assured of having quality individualised care that takes account of my values and rights as I've stated. I don't want these decisions made by staff of a residential or aged care facility or anybody else who hasn't got a clue who I am or things that I like or what my wishes could be. It covers the type of care I would like and expect. For example, that I'd like to be kept at home for as long as practical. More specifically, my plan will set out things I'd like even on a daily basis. My activities of daily living, where I'd like to have a shower and wash my hair every day, and I want to wear neat and clean clothes every day. And it'll list my other likes and dislikes. And no, I don't want to play bingo. Yes, I enjoy listening to fine music and sacred music. I'd like to have photos of my family around for me to see. I enjoy having pets visit. I love art and love being in the garden and going for walks. And I enjoy and want visits from my family and our church pastor. No, I do not want extreme measures taken if I'm very unwell. Yes, I'd want antibiotics for an upper respiratory tract infection, but no, I don't want tube feeding if I can no longer eat and swallow. I don't want CPR if there's a fair chance of negative long-term effects, say after a debilitating stroke. Yes, I expect to be pain-free and comfortable and have palliative care if needed and if available, or the equivalent care. It's important for me to know that my family will value having my advanced care directive and that they'll be empowered by knowing that my advanced care directive will ensure that I am cared for as I have requested. I'm aware that my plan can change and that I can change it if I want to and according to the directions in the plan. And a copy of this plan will stay with Tim and copies go to the GP and with me to hospitals and specialist appointments and to residential or aged care facilities. Tim and I are aware of supported decision making and how this can help Tim in coming decisions about care or other things. I'm confident that Tim will act according to my wishes, as we've previously discussed and recorded in my advanced care plan. My advice to anyone with or without dementia who hasn't got an advanced care plan in place or hasn't thought about supported decision making to actually do so as soon as possible. It's the assurance that your wishes will be adhered to should you no longer be able to make decisions about your care in the future. You're not admitting that you're on the slippery slope or you're about to die, far from it. You're ensuring that when and if the time comes, you're empowered to have your individual rights and values, your likes and dislikes adhered to by whomever is looking after you. And these decisions are not made by someone who knows absolutely nothing about you. And remember, it's really just doing the simple thing of planning for the future with the insurance that you'll be cared for as you've stipulated. And I hope you all race off and complete your plans now. Thank you very much.
And thank you for your heartfelt and genuine story about you. And that's, as you say, exactly what advanced care planning is. Expressing your likes and dislikes, your preferences for future care, and sharing that with your decision makers so that they can advocate for you into the future. And I think you're now our new pin-up girl for Advanced Care Planning Australia because you capture what advanced care planning is just so beautifully. And I am so grateful for your contribution in this webinar, and I'm sure everybody attending will have benefited a lot from your contribution and your story. Thank you, Anne.
Thanks, Santi.
I'm now going to pass over to Dr. Dimiti Pond, Professor Dimiti Pond, who is a GP and also an honorary professor. And Dimity is going to talk about some of about advanced care planning from a doctor's perspective and some of the issues that she may have faced and share some stories. Thank you, Dimity.
Thank you, Santhi. And a big thanks to Heather and Anne for those wonderful contributions about advanced care planning, just to get us all on the same page about the benefits of advanced care planning. And I must say, as a GP, I really like it when my patients have an advanced care plan that I can put in the notes, because that will give me direction as well. So it's not just the carers and the family, but also the health professionals welcome direction about planning for the future. Sometimes, so there are a few different ways that you can interact with the health professionals about advanced care planning, but I'll start with the less than formal way, which is a lot of my patients find it very difficult to get their heads around those forms. And so we have a bit of a discussion, and I might summarize that in a few dot points. So this is not a formal advanced care plan. It may be that with the degree of cognitive impairment, the person and one of their family carers will sit with me and just have a discussion. I had one quite recently with someone who is actually a nursing home resident, but comes to see me in the practice with her husband. And we just discussed whether she would want to go to hospital if she becomes ill. And we discussed that if going to hospital was not going to actually fix her, then, and she was not too uncomfortable, then she'd rather stay in the facility. So I documented that. That wasn't in a written one. She wasn't actually able to probably consent to that legally. Craig might talk more about that, but it gave me an idea about whether if the facility rang me and said, "Oh, she's got an infection. Do you want her to go to hospital?" I could say, "No, let's try some simple measures in the facility." So that's very helpful for us as well. But moving on to the more formal advanced care planning, which is really the focus of this webinar, there's a couple of different ways you can do it. So both of our consumer and carer people have talked about the variety of forms that there are across different states, and in fact within states there are different forms too. And often in New South Wales, where I am, the local health district, which is the hospital and community services, they have a form, and the adjoining local health district has a different form. So it's good to find one that might relate to where you're going to be in later stages of dementia. So there's those forms, and you could fill one in perhaps with your family and then deposit it with the GP. And we would welcome that, as I said. But sometimes family is not easy to find. I certainly have patients whose family are all interstate and in their 90s with a degree of dementia. They can't manage to get all that together. Mm-hmm. So then they may come to us and ask for some help and assistance with the advanced care planning. And the different general practices have different ways of doing this. Most of us will have some forms, some local forms that we use. Some of us will do that. We'll ask the practice nurse, the GP practice nurse, to sit down with the patient and the family and work through the forms in that way. Others will prefer it if the GP does it, or it might be that the GP does some of it and then sends the person off to discuss with their family and then come back. So it may be spread out over a few consultations. I would have to say that there is a fee for engaging with the practice nurse or the GP. So, and different GPs handle that differently. So you may have to pay additional apart from Medicare rebate. So, but nevertheless, that help is available. And as I said, it's for us too. We welcome having your advanced care plan on our records. So the other thing about that is we know that your wishes may change as time goes by. So, for example, when the pandemic came, in the early days of the pandemic, you might recall, a lot of people ended up in intensive care for days or weeks, sometimes on ventilators. And when they came, if they were quite elderly, when they came off those ventilators, they couldn't quite return to how they had been before, often, because that's a very significant illness, COVID and being on a ventilator. And so patients who told me that in the past they wanted everything done, we reviewed their advanced care plans and drew a line at the ventilator. So, when they were 65, they wanted everything done. But when they're 85, if they're not going to do well on a ventilator, it's time to draw a line and say, in that case, I don't want to. So there's that kind of revision that needs to happen. So please don't just lodge your advanced care plan with the GP and hope that in 20 years it'll work, because it may not. It may be not what you would want once you hit that age. So, and your values change too. So people alluded to some of the different aspects of advanced care plan. And as we said, there are different forms. So the questions on those forms are different. But broadly, there are two different sorts of answers that will help to guide the family and the health professionals. The first one is around values. Your values. That sounds a bit waffly, but for example, on one of the forms that I use, there's a scale that goes from 0 to 10, and at one end is quality of life, and at the other end is length of life. And it's from the Advanced Project, if anyone's interested in that. And the person can put, do they want their life lengthened and all stops pulled out, like my 65-year-olds who said they want everything done, or do they prefer quality of life and would sacrifice, 10 days on a ventilator in intensive care if they're not going to end up with a good quality of life. So that kind of helps us a little bit, because you can't actually predict every situation. And as Heather said, there are so many difficult decisions to be made. And you can't predict them all. So then there's also a series of more specific indications that you might give, like you prefer to die at home, or as my patient said, I'd prefer to stay in the facility as long as, if it's not going to make any difference and I can't be cured from whatever I've got at the time, I prefer to stay in the facility where I know and I'm comfortable. So those kinds of very more specific instructions can be included as well. And there may be some that you want very specific around end of life care. You might have some spiritual needs that you need addressing, or other issues like that. So it gives you the opportunity to look at a whole lot of different aspects of end of life care. And of course, it's also good to discuss these with other health professionals, not just the GP and the practice nurse. So if you have regular health providers, and unfortunately, as we get older, and I know what it's like to get older, you end up acquiring a few different diseases quite often, and you acquire a few different health professionals then who you might see once or twice a year. It's good for them to know what your advanced care plan is as well and have it lodged with them, because it will help guide them with their decision making about your particular illnesses. So, and you need to, I have a relative who's a community nurse, and she said that advanced care plan needs to be everywhere. It needs to be next to the front door. It needs to be with the ambulance service. It needs to be with all your health professionals. It needs to be at the local hospital. It needs to be, some people put it in the freezer in a plastic bag with a little note on the fridge. Have a look in there for my documents. So she said, otherwise it won't, people won't know what's in it. So there may be creative ways you think about making sure that that gets actually read. And so that brings me to a story about one of my patients. So this lovely lady was living in residential aged care in a nursing home. I looked after her for 5 or 6 years. When she came into the nursing home, she had early dementia, and she wrote an advanced care plan for the nursing home, and it was written actually in her own writing, and it was very, very simple. It said that she did not want to go to hospital at all, and that she did not want any intravenous fluids or medication at all. And so that, an advanced care plan sounds very daunting, but that was a simple one that she was able to write that and sign it. And her son, who was her enduring guardian and power of attorney and only living relative or immediate relative, he had signed it as well. So things went along very well in the facility. She developed a whole friendship group in the facility. She was she loved to chat and enjoy life. But as her dementia progressed, she ended up unfortunately being bedbound, which does happen sometimes. People end up having to stay in bed for long periods of time. And she was well looked after in that facility, and the nurses all knew her because she'd been there for a long time. And she got to the point where actually she couldn't remember her son's name, but she'd smile when she saw him. She recognized him. So it was a point where she wouldn't have been able to verbalize her wishes as such. And at that point, she developed a chest infection, a severe chest infection, which sometimes happens because swallowing is affected with advanced dementia. So, and some food had gone down the wrong way. And so the facility said, well, she'll have to go to hospital. And I knew about the advanced care plan. Now, that advanced care plan, let me warn you, was in volume 1 of 3 volumes of notes. And volume 1 was in the admin section. And of course, she got sick on the weekend. So we actually had to wait until Monday to get the actual plan out. So this is where it's so important for your GP to know about the plan. But I said, she doesn't want to go to hospital, and she's written it down. We'll get it out on Monday. And there it was. And the facility was then very happy to just look after her in the facility, knowing that. And her son concurred. He of course, knew about that as well. So what we did was give her a little bit of medication by mouth, some antibiotic by mouth. Wasn't going to actually cure the chest infection. That would have taken something stronger, but she didn't want to go to hospital and get something stronger. And we also gave her something just to settle her down. She was a little bit agitated because she was having trouble breathing. That helped her with her breathing. So she actually was much more comfortable that way. And for 4 or 5 days, she was just sort of peaceful in bed, sleeping a little bit with the medication to calm her down, waking up sometimes. The more distant relatives came from interstate. The room was filled with flowers. The staff were very attentive because they really loved her. A lot of those staff had known her for so long. And then towards the end of that time, she she obviously the chest infection worsened and she got hot and became sort of had more trouble breathing, and we had to give her some more medication that just calmed her down. And she ended up just passing away, surrounded by her relatives, in her own room that she'd been in for 5 or 6 years. And it was a very, very, very peaceful, wonderful way to go. And if you compare that with having been sent to hospital with advanced dementia, not understanding what's going on, lights on all day and all night, various tubes in every orifice, and being sent back maybe over the chest infection, but not over the dementia, because that hospital visit would not have done anything for the dementia. So it would probably have just upset her. So I think that, and then she would have gone through the whole cycle again in a few months because she was at that stage. So I think that she had control over how she wanted to go. We were all completely comfortable with it because it was written down and we knew that's what she wanted. It wasn't a huge effort for her to write that in early stages of dementia, and it was quite clear. And her family was on the same page about that. So if we could all aim to have that kind of end-of-life experience, it would be wonderful, wouldn't it? And maybe we can't all, but having the advanced care plan can help to promote that. So I'll leave it at that.
Thank you so much, Dimity. And I want you as my GP because I think you've just captured the beautiful process of advanced care planning and how it often starts with an early conversation and a few points, progresses through that process and wishes change, as you say, and the importance of re-looking at that and revisiting that. And also the importance of sharing that document with so many people so that they do know what the wishes are. And even if they can't find the document on the weekend, that everybody has had the conversation and shared the information so that everybody is on the same page. And those days towards the end of life can be all about the care that's delivered rather than any questions about whether or not to send to hospital or other things. And that good end of life care is very peaceful for the majority of people. So I really do appreciate your contribution, Dimity. Thank you. I'd now like to introduce you to Dr. Craig Sinclair, who is going to speak to us about supported decision-making and substitute decision-making, and also about the concept of will and preference and capacity. So we really look forward to Craig's presentation today. Thank you, Craig.
Thanks very much, Xanthi, and thanks to everyone else on the panel. It's great to have a chance to be part of this webinar. So before I start, because I will move through some of these points a little bit quicker, just to recognise what has already been said today, and so I don't restate some of those things, but I think some of those really important points raised by others about planning around our values and expressing our values, and then also thinking about what particular specific treatments or things we would really want or not want to happen. And so these are different types of decisions in a way. And that for a person who's living with dementia, and people who are affected by dementia know this well, it can be a complex condition. It's very unique to each individual person. And the way that it affects our thinking and our decision-making as it progresses can mean that a person is actually needing help or or needing a substitute decision maker for a longer period of time than in some other conditions. So for some people coming to the end of life, they may be happily making decisions about their care for the majority of that time, and it might just be in the final stage when they become more unwell, more tired, disoriented, those sort of things, and it becomes really difficult to make those decisions then. But for a person who's living with a progressive cognitive impairment, that period can potentially be a longer period. And so, as Dimity was saying, we need to be thinking about the specific treatments that I might plan for. I can't know all of those possible scenarios, and that's where the importance of telling your story about what's meaningful to you and the values that inform your decisions give guidance to, you know, the Heathers of the world who are doing their best to try to interpret and to, you know, put those decisions into effect. So I just wanted to touch a little bit on, you know, from my background as a research psychologist, on what decision making is and how it is a product of different functions of the brain, and how these can be affected in different ways for different dementia conditions. So if you think about making some of these decisions, and we all, you know, want to be able to express what's most important to us and then give our own consent, ideally, for, you know, for the different treatments that might be available. But this requires things like perceiving information, you know, through conversation or reading documents, or maybe even feeling a sensation like pain. We have to draw on our own experiences and identify our goals, manage the emotions associated with that decision. We might have to be managing a social interaction with friends or family, and then integrating all of these different thoughts and facts and holding them in our memory while we weigh them up and decide which is it that we really think is most appropriate for us. And of course, we have to be able to communicate that in some way. So dementia can impact on some or many of those different brain processes. And we know that there's a lot of different types of dementia, and each of them can look different depending on a person's existing education or the different backgrounds that they've had in their life. So it raises this question of who can actually make these decisions and when. So when would an advanced care plan be considered a legally valid advanced care directive? And when might it need to be invoked? When would we say that a person actually, we can't get the decision from this person now, so we're going to have to refer to that advanced care directive? And some people might say things like, well, when a person's been diagnosed with dementia, that means they can't make decisions anymore. You do hear people say that, and it's not true. But what we would be looking for in that situation, and Xanthi, if you might bring that slide up now, thank you, is that the person has what we call decision-making capacity, and it's specific to the actual decision that's required at the time. And as we know, that sort of thing can fluctuate. So while a person may have had that decision-making capacity at another time, it needs to be understood at this time for this decision. And the sort of things that a professional might be looking for to assess that would be, can the person understand and appreciate the relevant information? So that means understanding it from a cognitive point of view. You know, what are the different facts, or you know, can they process them from that point of view? But perhaps even more importantly, can they appreciate what those things mean for them in their own life? They would need to retain the information, not over days or weeks, but at least long enough to use it in participating in that decision. And those sort of things can be supported through, you know, having information available on paper, or using different ways of helping the person to hold that information in their short-term memory. They would need to be able to weigh the different pieces of information. So weighing up the different options in some way, maybe not the way that you or I might weigh them up, but the fact that they are going through that process of weighing that information, working out what it is that fits with their own values, and then communicating their choice in some way, not necessarily verbally, because we know that for some people, the dementia is affecting their verbal communication. And so different ways that we can actually assist people in communicating their choice can actually enable people to make those decisions as well. So for people with dementia, we know that decision-making capacity can fluctuate, and it can be contested, the decisions about whether a person can make these decisions as well. So there's no simple test that tells us a person can or can't make decisions, but what we should be looking at is, are we seeing evidence that people are doing those different things in making the decision? Are they able to do that? And while the law likes things to be black and white, I think those people with experience with dementia know that this gradual and progressive process and fluctuating from day to day means that it's not always black and white. There is a grey space there where it's really important, like Dimity said, that we know the person well, we have knowledge of their values so that we can actually help them interpret what's most important. And just in wrapping up, I guess I'll talk briefly about supported decision making. More recent work has, I guess, identified that it is not just about making my own decisions or having someone else to make decisions for me, but in fact there is a phase where it would be very helpful if we can actually support people and assist them in staying engaged in decision making. So this comes from a social model of disability, where we think about a person's disability as not just caused by their impairment, whether that be physical or cognitive, but actually how it interacts with the environment and the accommodation that we can make for a person. So the example that you're probably very well aware of is that for a person with a mobility or a physical impairment, having a wheelchair and ramps that allow them to access buildings and vehicles, that actually reduces the disability associated with that impairment. And so what we need to do for people with dementia is try to find those ramps, those things that help people to not be burdened so much by those impairments, or to enable them to continue to participate in ways that they can. And if you might show that slide, Xanthi, we can see this along a spectrum that Xanthi's going to show here, where in some cases, the spectrum might be moving in the opposite direction. If we think of a young person with an intellectual disability who may be moving towards more independence, of course, with the nature of dementia and the progress of that cognitive impairment, it is I guess a trajectory there where we're supporting a person for as long as possible, but understanding that there may be a time in the future where those people helping need to take a more active role. And the really important thing in navigating through that, and that there's no, really black and white thresholds about when we shift from one to another, but it is a spectrum. The really important thing is trying to keep the person's values and their will and preference at the centre of the decision-making process. And the way that we do that is, if we're supporting someone, we're trying to assist them in expressing their own will and preference through things like providing decision aids or using our knowledge of what they've said previously and prompting, knowing the person really well so we know how they communicate, or even just providing more friendly context for making the decision, thinking about what's the best time of the day for that person to make the decision, giving them sufficient time, so not rushing, those sort of things. But if we are in that position where a substitute decision is made, again, the guiding principle is about what do we know about this person's will and preference, so that we can use that in expressing what that person had always felt was most important. And again, it's that combination of the specific directions they've given, but also the broader values that allow us to make some interpretation if there's an unexpected scenario that comes up. And so in finishing off, I guess the only other thing I wanted to mention is that there are, while there's, it's impossible to specify plans for every scenario, through knowing a person well and knowing what's meaningful to them, that gives us the best chance in helping in those uncertain situations. And so I think the things that really says is that we need to be valuing the input of carers and family members who know people well and have walked the journey with them, and trying to share that information with the health professionals who have that more specific medical or nursing or whatever discipline knowledge that they can bring. So I'll leave it there, Xanthi, as we're short of time, but thanks very much.
Thank you, Craig. And I think that what you've covered is just so profound, and so it's simple and yet profound, really, because it really is involving the person, their values, their statements about who they are and how that transitions over time, potentially. I just really appreciate your input. Thank you very much. Now, we do only have a limited amount of time, and we did receive hundreds of questions before the webinar, which is why we turn the question and answer chat. So I've got a few quick questions for people for the remaining time. So Heather, may I start with you? How do I introduce advanced care planning to my loved one when they don't want to accept necessarily that they have dementia?
Look, I guess that's a double-loaded question, but I guess one of the first things I would think about is there a way that we can help them to accept their diagnosis, and what resources might we have that might help them to accept that? Like Dementia Australia has a lot of information about accepting a diagnosis. But I guess the flip side is they don't need to accept the diagnosis. It doesn't have to be another dementia thing. It's a living thing. You know, a lot of people who are older have a level of cognitive decline anyway. So it's likely to happen to all of us. So it's a natural life progression. So I just want to build on what Craig was saying, because his presentation was fantastic. It was really good. But he was talking about just starting that conversation, that we just need to start, even if we just start with what your values are. You know, what wouldn't you want? That's another way, another easy way of sorting it out, especially when you can't walk or eat or you're being hospitalised and those life-prolonging stages. I guess we're also looking at opportunities. Is it a conversation over a coffee? Like Craig said, when we're making a specific decision, he talks about it being a good time for the person with dementia. I mean, that applies to aged care planning as a whole. You want to make sure you pick a good day for that person that you're caring for. You know, do you do it together? Like, Mum, I've come across this thing and I'm doing it for myself and my family. And I think it's really important. It could be a really beautiful bonding thing as we reflect on our lives together, and thinking about what our values are and whether our families actually know what they are and how we'd feel if they didn't know and they were forced to make these decisions. You know, so to me, like between, you know, I'm back to that thing. It's a gift between each other and it's a gift to our families. So, and it's looking for opportunities to discuss it. You know, often we're going to the doctor or specialists and all that sort of thing anyway. So, you know, we might discuss with our doctor, like Dimity said, what sort of questions are we going to have to face, like from a medical aspect? And is that something we can discuss with the GP? And then we've thought about our values and how will they be used to guide our decision making. So do we need to do some research? Do we need to look at the Dementia Australia fact sheets? Because they've got a lot of information about the decisions that need to be made. So I just, so I think that what Craig was leading into really makes sense as we face issues along the way, but as also making that whole plan as well.
Great, thanks Heather for answering that. We've got time for one more question, and I'll throw to Anne if you don't mind. Anne, what preferences for medical care and quality of life statements should be included in advanced care planning documents? And where can I go for help on this?
Oh, yeah, thanks, Xanthi. A lot of that I sort of talked about when I spoke before, so I won't, knowing we've got short time, I won't go over it all, except to remember you can put as much in it or as little as you want. And, you know, it just makes you empowered to be cared for as an individual, so with your values and rights. And that's going to assist the doctors and the carers and the family and the aged care facility to make decisions respecting your wishes that you want in your aged care, in your advanced care plan. And a lot of those wishes are to do with tube feeding, things like that, whether you want CPR, which Dimity talked a lot about, and antibiotics and hospice care, palliative care. And you can change it again, you know, it's not set in stone, you can change it as you like. The quality of life issues, well, you know, and I think that's really important, how you want to spend your day. You know, do you want to sit in front of the television? Do you want to, you know, have a shower every day? Do you want to lie in bed till midday? Do you want to have red nail polish? You know, even simple things like that can make your quality of life really, as an individual, you know, important to you. You know, there are people that like folding towels or touching books and things like that just make them feel comfortable, or having lots of pictures of the family around and the grandchildren, or having visits from the church pastor or whatever. So they're the quality of life issues. You know, they're things that are going to make that person more comfortable in their life as their dementia will increase, but just give them more things that are just, you know, maybe it'll maintain them being off some sort of medication because they've got some comfort and there are things that they like and they're being treated really well. Where would you go to get the information? Well, I think we all know about Advanced Care Planning Australia, and that you've got all the states' information on there. The Department of Health and Ageing and Dementia Australia has got their National Dementia Helpline, which is 1800 100 500, and they have information about making how you can go and make it your plans and things. And GPs, again, like Dimity, and geriatricians, neurologists, you hope too that they'll have some of that information. And remember, it's just doing simple things to ensure that you're looked after and looked after as you want to be, with the respect and as an individual with your own rights and likes and dislikes. I think that's a nutshell.
Thank you so much, Anne. And I have put up here the website and the phone number for the National Dementia Helpline, and also the page for Advanced Care Planning Australia, including their support service line if you need information about advanced care planning. I know we've gone a few minutes over time, but I really want to thank so very much Heather, Anne, Dimity and Craig for your incredible contribution in this webinar. I hope everybody who's joined has found this beneficial, and I've certainly learned a lot, and I hope you have too. As I mentioned, we'll be sending out a survey, and in a few weeks' time, probably after Easter, we will address the questions that we received through the registration process with the frequently asked questions that we will email out to recipients. The recording of this will be available on the Dementia Australia YouTube channel and Advanced Care Planning Australia YouTube channel, so you can view this again in the future if you'd like to revisit some of what we've discussed. So thank you again, enjoy your day, and good luck with your process of thinking about, talking about, and potentially documenting your wishes for your future care. And may you continue to live well with dementia. Thank you.